All right, let's just jump right into this. Urgent public health explainer. We're looking at a sudden, massive spike in, well, a pretty explosive illness that's literally ruining summer holidays right now. This is a fast-moving, cross-border situation heavily impacting tourists. We're basing this on breaking data and reports from Londoner.news alongside the CDC and the UK Health Security Agency. Honestly, if you or your family are traveling this summer, you absolutely cannot afford to miss this. Just listen to this terrifying quote from Nick Palmater. He's a 29-year-old traveler who just got back to the US, and this perfectly captures the severe reality hitting thousands of tourists returning from their summer getaways. Look, we aren't just talking about a mild case of traveler's tummy here, right? We're looking at a deeply debilitating gastrointestinal infection that is striking down holidaymakers left and right, and it's sending public health officials completely scrambling to find the source hiding in our incredibly complex global food supply chains. So here's how we're going to break this all down today. 1. The Mexican holiday nightmare. 2. Unmasking the Cyclospora parasite. 3. A wider global outbreak. 4. Tracing the contamination source. 5. Treatment and prevention. And 6. Stay informed and safe. Section 1. The Mexican holiday nightmare. When we map out where this is happening, it's pretty wild. Out of the UK cases where health officials could actually track the patient's travel history, a staggering 92%, yes, 92% had recently visited Mexico. We're talking specifically about the highly popular Riviera Maya or Cancún regions. And here's the real kicker. These weren't backpackers roughing it off the grid. Many of these travelers were actually staying at high-end, luxury, all-inclusive resorts, eating and drinking everything provided right there on site. Oh, and for context, the remaining 8% were linked to the US and Kenya. The numbers we're seeing here are frankly highly abnormal. The UK Health Security Agency reported 67 cases in just an 11-week window, spanning from late April to mid-July. Now, to put that into perspective for you, the annual average for the entire year between 2022 and 2025 was just 93 cases total. So in less than 3 months, the UK has already seen 72% of a typical year's entire caseload. It's a sharp, alarming spike, and officials expect these numbers to climb even higher as the summer holiday season rolls on.
Part 2. Unmasking the Cyclospora parasite.
So, what are we actually dealing with? The absolutely crucial point to understand is that this isn't your standard everyday bacterial food poisoning. Cyclospora cayetanensis is a microscopic parasite. It doesn't even occur naturally in the UK. It's typically found in tropical and subtropical regions. But what makes it truly unique and honestly incredibly frustrating for health officials is its life cycle. Once the parasite is passed in human feces, it requires a 1 to 2 week waiting period out in the environment to become infectious. Because of this necessary environmental waiting period, direct person-to-person transmission is highly unlikely. You literally have to ingest it from contaminated food or water. And the resulting illness, cyclosporiasis, is completely grueling. Patients typically start feeling sick about a week or so after swallowing the parasite. We're talking explosive, watery diarrhea, severe stomach cramps, profound fatigue, and significant weight loss. If you don't treat it, this illness is technically self-limiting, sure, but it can drag on for up to 6 weeks. And sometimes symptoms seem to go away only to relapse right back. This drawn-out nightmare poses severe dehydration and malnutrition risks, especially for the very young, the elderly, and anyone who may be immunocompromised. Section 3. A wider global outbreak. Now, to grasp the sheer scale of this crisis, we really have to look across the Atlantic. While the UK is tracking dozens of cases from returning travelers, there's a concurrent massive outbreak literally tearing through the United States. We are looking at reports of over 18,000 cases spanning 45 different states. So no, this isn't just a few bad salads at a single resort down in Mexico. This shows just how widespread and deeply embedded this contamination truly is within the entire North American fresh produce supply chain. Number 4, tracing the contamination source. Trying to track this massive U.S. outbreak has been like chasing a ghost. Back in 2011, the Food Safety Modernization Act was passed, which was supposed to give us a strict food traceability rule. But because the FDA proposed delaying this rule to 2028 after some heavy industry pushback, authorities are out here fighting a 2026 outbreak with outdated tracing tools. And it all really culminated in July with this incredibly confusing, poorly communicated recall of shredded iceberg lettuce by the mega producer Taylor Farms. They supply major chains like Taco Bell. Then the situation got even muddier when the FDA reported a false positive test on lettuce that wasn't even part of the recall.
Talk about adding massive uncertainty to a public health response.
Now, we're just impartially reporting the facts here, but media outlets, specifically The Guardian, have highlighted some large political donations made by Taylor Farms to a Trump-affiliated super PAC. Look, we aren't taking any political sides whatsoever, but this context is important because it highlights the intense layers of complexity and public scrutiny surrounding how the federal government and the FDA are actually handling this massive recall. When public trust in food safety starts to waver, any perceived political connections can really complicate the official messaging and how fast people think the regulatory response is moving. So, beyond all those regulatory delays, there's a profound scientific challenge we need to address. Why is this specific bug so incredibly elusive? Well, the parasite is notoriously difficult to find in fresh produce, especially compared to human stool samples where it just thrives. Plus, contamination on a farm or in a water source can be totally temporary. Think about it. By the time health officials identify a cluster of sick people, interview them about what they ate 2 entire weeks ago, and trace that specific food back to a farm in central Mexico, the contamination in the soil or water might have completely washed away. It's a giant puzzle where the pieces keep disappearing, meaning outbreaks often spread like wildfire long before the exact product is definitively identified.
Section 5. Treatment and Prevention.
Listen up, because this parasite is incredibly resilient. Your standard travel precautions, like iodine or chlorine water drops or routine chemical sanitization of your produce, they will absolutely not kill Cyclospora. And on top of that, the standard antibiotics travelers usually take for typical stomach bugs, like azithromycin, are completely ineffective here. To actually treat this, doctors have to use a very specific antibiotic combination called TMP-SMX, which most people know as Bactrim. And as for killing it in your food, you need high heat, for sure. We're talking boiling water and cooking produce to at least 158 degrees Fahrenheit. That's 70 degrees Celsius to actually destroy these things. If you're prepping food at home, following these exact CDC guidelines is hands down your best defense. Wash your hands thoroughly with soap, vigorously scrub firm fruits like melons and cucumbers with a brush, and make sure you cut away any bruised areas where parasites love to hide. And honestly, if you want to be completely safe, just cook your produce to at least 158 degrees Fahrenheit. Finally, always refrigerate any cut produce within 2 hours. And please remember, even if your fancy bagged salad says pre-washed, you still need to take precautions. Washing alone simply cannot guarantee the complete removal of this incredibly stubborn parasite.
Number 6. Stay informed and safe.
Okay, so what should you take away from this? If you are heading down to tropical regions this summer, especially Mexico, the UK Health Security Agency strongly advises you to stick to thoroughly cooked foods. Just avoid fresh, uncooked berries, soft herbs like cilantro, unpeeled fruits, and raw salads altogether. Stick to drinking only securely bottled water. And most importantly, if you develop explosive stomach issues after you get back, seek medical help immediately. You have to explicitly tell your doctor your full travel history, like down to the exact resort you stayed at, so they know to test you for Cyclospora and get you on the right antibiotics.
Because this is such a rapidly evolving cross-border public health crisis with massive implications for summer travelers, staying updated is absolutely crucial. To stay ahead of this ongoing investigation and keep your family safe, make sure you visit londoner.news. That's londoner.news for continuous local and global updates, breaking alerts, and much deeper analysis of these ongoing recalls.
This entire outbreak really exposes the hidden fragility of our modern diet. I mean, we expect fresh berries and crisp lettuce year-round, but that relies on a vast, interconnected, and sometimes wildly vulnerable global network. So with our food supply chains so deeply interconnected, how confident are you in the safety of your next summer salad? Thank you so much for joining me for this explainer. I really hope breaking it down like this helped clarify a very complex and urgent issue. Stay safe out there, scrub and cook your produce, and keep questioning the world around you.